Hi, this is Dr. Ferreira and Shannon Linda, NP, coming to you from Wisconsin Rapids again. Today we are going to talk about neurotoxin. I was tempted to say Botox a while ago. We use Botox interchangeably for all neurotoxin, but Botox is its own brand. There are many types of neurotoxin we use in aesthetics. The main four I think around is the Jeuveau, Botox itself, Dysport, and Xeomin. We use all four here at WOW. Our workhorse neurotoxin is the Jeuveau, however. We use Jeuveau more than anything else. We like the Jeuveau because it's a little bit less expensive than the brand Botox, and it's the same weight. So we expect it to behave like Botox once it's injected in the muscle.
And it's a newer generation, so it has fewer impurities, so you're gonna have less headaches, and people tend to have a good outcome with the medication.
How does the neuromodulators work? So when we use neuromodulators, what we're doing, we're blocking the nerve impulse from the nerve to the muscle. We block the release of acetylcholine, which is the neurotransmitter that make our muscles contract. We block that movement from the nerve to the muscle. There is no impulse to tell the muscle to do anything, so the muscle relaxes. And that we do that transiently. And remember, when we say Botox, we mean all neurotoxin, just to, we use it interchangeably, just to clarify. One of the biggest myths about Botox is like it's not well studied. We have been using Botox in the United States clinically since the 80s, 1989. It was FDA approved for blepharospasm. And since then, we have used it in aesthetics, lots and lots and lots. Botox have many different applications. Botox is one of the most well-studied drugs. It's only second to Viagra. We want to think of Botox as what we call an entry drug. Most people who do aesthetic procedure end up doing Botox.
Botox for a lot of people can be scary, and women have apprehension about it, and so this is just kind of like to dispel and disarm the comfort level and get a better understanding on the way we use it and the safety level of it and how well it's studied.
Botox is widely used in aesthetic at the beginner level. 90% of people who get Botox at the beginner level. They can get Botox from most people who inject Botox. They get Botox for the glabella area, that's the area right between the eyes here, and also the crow's feet, the smile lines that come on the side of your face over time.
And then also the lip flip is very common in that injector nurse category.
In addition, then there's the intermediate level. I want to think about the stuff we do on an intermediate level. We use them as add-on to other modalities. I wouldn't use them as first-line treatment, We frequently talk on this channel, or we usually marry different modalities to get the result for our client. We don't use one modality to get the result. So, for example, if we working on somebody's under eye bag with Morpheus, we use Botox to help soften the results and make the results better. We also use it on the DAO, we use it for gummy smile, we use it for nasal flaring, we use Botox for necklines. As I say, I always use Botox in conjunction with some other modality when doing the intermediate. And then there are genuine medical conditions we use Botox for also. We use Botox for essential tremors, we use Botox for hyperhidrosis, we use Botox for bladder spasm, blepharospasm,
headaches,
TMJ pain, and also we use the TMJ area, we inject the Botox in the masseter for facial slimming.
Botox can augment a lot of the work that we do. So if we're doing Morpheus and the patient or the client is wanting softened wrinkles and the overall look is to be softened and have a refreshed appearance while they're in the healing stage of the treatment, the Botox can help relax that so they get a better result because you don't have the wrinkles, and then your overall result is going to be better.
The other day we had a lady here at WOW Aesthetics. She came in with essential tremors. She's been having it for a long time. It gives her headaches and life is just not happy for her.
And it's progressively getting worse.
So the muscle we inject for essential tremors is called the splenius capitis. That muscle is deep in the back of the neck. There's no way anyone can do it without eyes, basically. You have to see the muscle to inject it, and it's not just below the skin. So we had to use ultrasound to find that splenius capitis, and we injected her along, and she's doing much better. She came back for even her second treatment and couldn't be happier. And that gave us a good feeling.
I would say she was up to like 85% reduced on that tremor with that treatment. Botox can treat platysma bands, which are in the neck, like when you make this tight face and you have these come down, especially as you get older, they get stronger. Treating them can do a couple of things. It can release like the pull down of the smile right here. So when people are wanting to bring this up, it doesn't necessarily have to be something right here. We can treat this down here and this up here, and this can help bring that up. It also gets rid of some of those fine lines in the neck and just make the neck look overall smoother. It works good when we're doing a Morpheus treatment because it helps relax that while it's healing. and then you get a nice smoother outcome. I think it's important to talk about the biggest thing when girls come in who either have or haven't had it when they have the anxiety is they're worried about this heavy brow or heavy lid, and that actually sometimes isn't the injector or a misunderstanding on how to communicate the look you want or why that's happening.
Yeah, we encourage our client to tell us when we are doing the pre-procedure analysis what outcome they're looking for. Some clients does not want anything to move, you know, and we can get that done. And some clients want a little bit of freedom of their brows, and we get that done too.
Have expression and
yeah, but usually we stay 2 centimeters above the eyebrows, anywhere lateral of the pupil area.
lots of times when this up here is atrophied or you're older or this is not a strong muscle up here to begin with, when we relax that and the tissue is over the top, the tissue can come down a little bit. So you're not really having an issue with your eye or your brow. What that is, the muscle right there has relaxed, so the tissue has now come down and you're feeling the heaviness of your own skin over that brow.
And then, you know, some people use the frontalis muscle, that's this forehead muscle here, to help the eyebrows go up to open their eyes. So when they lose that frontalis, they get that heavy feeling. But, you know, all it lost is the frontalis, and the Botox is essentially doing what it's supposed to be doing.
And it's not permanent, it wears off, and so sometimes we just have to help clients understand that, and then the next time we know you have a preference on how you want to feel, so we just adjust for it.
And I'm sure it has happened to us, where we have seen a client for one time and they probably go to another person looking for a different result, because we see it a lot in our practice where people come from another provider and say this, that happened, and we have to explain that. You know, the provider probably did it right, but you know, it's just how you reacted. And now we know that, and we armed with that information, we can go in and do it better, and we seem like we're better than the other guy, but that's not necessarily the truth, you know. So sometimes you just have to stick with the person you are and you are with, and let them, you know, figure it out, you know, because it's always, with every client, we always try to tailor the treatment to the specific client. We use some of the same tools and the same modalities, but you know, we try to tailor what's needed for that specific client.
And if Botox is not going to be a good fit for you, and we can see that, we, you know, are honest and tell you the things that we think would help you achieve what you're coming in for.
Yeah, there's a few people that we can see straight up that Botox won't solve all the problem. It might help, but won't solve all the problem. If they come in and they have resting lines, and the muscles are relaxed and the lines are there already, then that's not a Botox problem. We might use Botox in conjunction with something else to help you get where you want to go, but Botox alone won't fix that problem.
And as a consumer of aesthetics, it's good to know if you go to a place that only offers Botox and fillers and that level of stuff,
that's what you'll get.
Then that's what you're gonna get, because they don't have anything else.
A lot of people who do aesthetics, I know it's a hard job, so we respect everybody who is doing this, you know. Botox is usually a quick procedure. Most times when we do the regular Botox for glabella area, frontal area, and crow's feet, we can do that in less than 5 minutes. Most of it is set up and, you know, really meeting and greeting our clients. We like to, you know, talk to our clients lots and lots, so most of the time is that when they come in for Botox, it's just a social event, you know. Usually with Botox, after the Botox procedure, especially for the basic Botox of the frontal, glabella, and crow's feet area, we want our client to sit upright for the next 4 hours. We encourage them not to rub the area of injection, because we don't want the neuromodulators to spread to areas that we didn't intend it to be. And keep the area clean, of course, and you know, keep working the muscle out. So if we're injecting the muscle, it's okay to work the muscle out, but it's not okay to rub it out. We have the client not exercise for the first day after the procedure, or put themselves in any contorted position. There are some people who metabolize the Botox faster than some, but usually it lasts about 3 to 4 months.
Botox lasts a lot longer if you can manage, you know, that little short time after you get your treatment with the post-care, you know, refraining from exercising, refraining from laying down, trying not to wear headbands and things like that. That's going to metabolize it faster. So just that short little couple of days of no strenuous exercise can really make your Botox last a lot longer.
With Botox, we thought we would see our clients every 3 months, but after getting it every 3 months for 2 or 3 times, then what we have been seeing is people need less and less Botox when we get into the maintenance phase.
Especially when they're doing good skincare and, you know, living healthier lifestyles, the smooth lines really maintain a lot longer. You kind of train yourself not to make certain expressions, and so you're not making those wrinkles in between your Botox treatments. And then over time, you know, once or twice a year is really where we have clients who are 2 and 3 years out from Botox.
And again, for the purposes of this talk, we're using using the word Botox
Yeah.
for all the 4 neuromodulators we use. We at Wow Aesthetics, we don't really take insurance for aesthetics. So we always suggest if a client can get this done through their insurance, they go and see somebody where they can pay the insurance and get the procedure done for headache, because insurance covers the headache for Botox.
Sometimes it does.
Yeah, sometimes it doesn't. Sometimes, we do it for clients too. We're happy to do it for them. We also have Care Credit here that will help a client take care of payments more comfortably. And at Wow Aesthetics, we try to meet our clients where they are in terms of price points, geographic location.
And their aesthetic journeys.
There's plenty information about Botox out there, and we have a lot more. This was, from the top of our heads, and we're happy to, address any questions. This is near and dear to our heart. If there's a nurse injector out there who want to practice or get better at Botox, they can even contact Wow Aesthetics. We'll help them through. We'll help them with intermediate and advanced Botox, or just help them with any information. Clients, you're welcome to ask questions anytime. Our goal here is to raise awareness about the tools and the procedures that we have to make you look and feel better. Even the people who are giving care to clients out there. As again, I said, 100% respect to you guys, and keep doing what you're doing. If you make one person feel better, it's job done. If you have any questions or want to know more about what applications we can do for Botox, medical and otherwise aesthetics, just comment below and look us up at Wow Aesthetics. We're happy to talk to you.
I was gonna say, I'm Kevin and this is Shannon.
Again, I'm Kevin.
And I'm Shannon.
We are with Wow Aesthetics. Remember, we meet you where you are.